Assalamu alaikum. I had a question about loops, okay, previously, and the student was asking, do I use loops or not? Okay. Well, the idea is loops does show you a lot of good, very good, or excellent things, okay? It works like very specific to the area. It even looks like you're using a microscope. So you'll see a lot of details of your preparation. But the idea is if you are still learning, in the learning phase, I would prefer that you don't use loops at all times. Because if you get used to them, okay, the loops are confined, okay, confined in the area. So if you get used to them, you begin losing some of the area factors, for example, adjacent teeth and so on. So it's confined to the area you're working with. I would like to use loops if taking this in account, I would like to do them when I do my quality check, okay? Just the last bit of quality check. When I want to quality check my work. Secondly, you're in the learning phase. Suppose sometimes you lose your loops or you don't have them in the clinic and so on. You will be handicapped. It handicaps you because you're too used to them. So it's handicapped if you are not used to otherwise without loops, okay? You're handicapped without them. You feel that you're lost. You cannot work in the clinic if you don't have them. So in the learning phase, I would prefer that you don't use loops in your regular procedures. If you want to use them in the last step where you're doing the finishing or the quality check, okay? So this is my idea about loops. What magnification do we have? We have 2, 2.5, and 3. You can use any magnification that suits you, but use them accordingly when you're doing the procedure. You have to have a dry field, you have to good lighting, and so on. What was your experience? Why did you sell your loops?
اللي هو
Which one?
بطلت قادر يعني بطلت قادر أشوف.
Okay, you lost the ability to see the area or the field altogether.
صرت بشوف سن وحسيت حالي خلاص مش هتعود عليهم فتركتهم.
Okay, you become dependent on them.
Yeah.
Really you become so dependent on them that you cannot go without them.
هم مريح الظهر صحيح يعني بتخليك تقعد قاعدة.
Advantages?
Yeah.
What are the advantages?
يعني
Posture?
البوستشر
Helps
كثير.
you?
البوستشر كثير ارتاح. Yes.
What other positive things did you get from them? Details, okay.
Details.
What else? What did you get? Have you used them, doctor? Yes. What do you get from the loops? Advantages? Nothing else? Anything, doctor, else? Okay. The idea is also that they get that they are technique sensitive. Meaning that you have to keep them in a good environment. They should not have moisture around. You should not have any fogging on the glasses. Depends on what system you're using. So my advice for you, if you're going to use loops, use them occasionally. Don't be dependent on them, and don't keep yourself confined in them. Okay? So try to get them in the last bit of your preparation where you become, and whenever you become older, the visual acuity of your visual acuity becomes less. Then you'll begin to need them, okay? So leave them for later ages when you become really dependent on them and you really need them, okay? So this is my opinion about loops, and try to avoid them while you're learning. Use them in confined areas, confined situations, and leave them until you get older and you really need them. So that's my advice for you.